12 weeks pregnant, what to expect and avoid. When you reach the 12th week of pregnancy, you will have completed the first trimester. Even after failure of subsequent pregnancy, the probability of a miscarriage occurring also decreases during this period. A moment like this can be ideal for the big reveal if you haven't already told your loved ones or coworkers that you're expecting. Baby's development at 12 weeks. In this, the 12th pregnancy week, your baby will go through several significant changes. They have grown to a length of around 3 inches and a weight of about 1 ounce. Because of the rise in hormone levels, their exterior sex organs will begin to develop shortly. Fingernails begin emerging, and your baby no longer has webbed fingers or toes. This is the week in which their eyes will become more closely spaced, and their kidneys will begin to excrete urine. By week 12, they have developed more sophisticated reflexes like sucking. Though you may not feel your baby's movements until weeks 16 to 22, they may begin on their own this week. The size of the fetus at 12 weeks pregnant. Your womb now dwarfs a grapefruit in size. The top of it, the fundus, may now be felt by your healthcare provider or nurse in the lower abdomen, above the pubic bone. At 12 weeks, the fetus measures close to 2.5 inches from crown to rump and weighs about 0.5 ounces, making it roughly the size of a passion fruit. Mom's body at 12 weeks pregnant. A month from now, you might still be able to wear your old clothes, but they might be a bit snug. You should probably start shopping for maternity clothes soon so you can avoid wearing anything too tight. The healthy weight gain up to this point is just 2 pounds. Your body is adapting in other ways to carry your baby, and these are the ones causing your genes to feel a little looser than usual. The size of your uterus, for instance, is expanding rapidly. It's possible at this point for your doctor to feel your uterus in your lower abdomen. 12 weeks pregnant symptoms. Here are some of the signs that you could be pregnant around the 12-week mark. Sore, bleeding gums. Your gums may enlarge, become more sensitive, and even bleed when you brush or floss due to the increased blood volume and fluctuating pregnancy hormones levels during pregnancy. This is natural and may even be healthy, despite the fact that it is unsettling. Keep up with your usual dental hygiene routine and see your dentist if you notice any changes. Some people get relief by switching to a softer toothbrush and washing with salt water, 1 teaspoon of salt soaked in a cup of warm water. Dizzy and weak. Hormone levels shift, and the body makes new blood vessels during pregnancy. As a result, you may experience moments of vertigo or lightheadedness. Wearing loose clothes, drinking plenty of water, avoiding prolonged standing, and eating frequently may all help. If you sit for a while, try getting up carefully, and if you need to switch positions, do it gradually. Lightheadedness is a symptom of low blood pressure, so if you also have stomach discomfort or vaginal bleeding, or if your symptoms continue, you should see your doctor. Scent perception sensitivity. During this time of pregnancy, your nose may be more attuned than usual. If you have a problem with unpleasant scents, you may try eating food at room temperature or cold, using a fan when cooking, or having someone else in your home clean the garbage. Bloating. Changes in hormone levels and a developing uterus might contribute to a woman's tendency to feel bloated. Some people find that eating more slowly helps alleviate bloating because it reduces the amount of air they swallow during meals. Being bruised or cut, bleeding. At 12 weeks pregnant or at any point throughout pregnancy, it is wise to contact your healthcare practitioner if you detect any bleeding other than light spotting, which may occur after sex, for example, particularly if accompanied by cramps. Changes in skin color. Hormonal fluctuations trigger a wide range of physical changes. Increased pigmentation is one of them. Melasma, or chloasma, sometimes called the mask of pregnancy, is a common skin disease that affects many pregnant women. About half of pregnant women experience this, and it causes discoloration of the face, especially the forehead and cheeks. Usually, these discolorations fade or become much less noticeable not long after giving birth. Physiological alterations in the breast. pregnancy often causes the areolas to darken. Early pregnancy symptoms of breast discomfort or soreness may persist throughout the second trimester. Methods for alleviation. If you're looking for support, a bra that fits well may assist. An already unpleasant situation will be worse by the use of a too tight bra. If lying down doesn't help, try placing ice packs, chilled cabbage leaves, or bags of frozen peas on your chest. Find a compact, silicone-filled product that you can store in the fridge and use under your bra if you're experiencing breast discomfort. Tips for you this week. Embrace loose styles. You should consume enough protein throughout pregnancy, whether it comes from beef, poultry, fish, or a plant-based alternative. Vegetables and fruits are great sources of vitamins and minerals, and you should eat them every day. Low-fat dairy, legumes, almonds, and tofu are other good sources of calcium. Start doing Kegels. In case you haven't already, you should begin doing Kegel exercises. Performing Kegel exercises assist in building stronger pelvic floor muscles, which in turn can help you feel more in control of your uterus and bladder. Aside from helping you avoid embarrassing accidents during pregnancy, this has many other advantages. When it comes to Kegel exercises, the difficulty level is low. To do this, you just engage the same muscles you would use to hold in pee or gas and compress your pelvic floor. Keep holding for a couple of seconds, and then let go. Minimum daily goal, 3 sets of 20. As your muscles become stronger, you may increase the number of Kegels you execute and the amount of time you hold each one. For more information on Kegel exercises, please read our guide. Written record. You should begin recording your pregnancy experiences in a diary. After the birth of your baby, you may wish to reflect on your pregnancy by reading through a written record of all the memorable moments. As soon as you start to show, you should think about capturing pictures of your growing baby bump every week. You may choose to include a hard copy of the ultrasound report in your diary after it has been completed. You may purchase a pregnant notebook from a local store or online, or you can make your scrapbook or classic diary to remember this special time in your life. Naming the infant. Is the process of naming the infant underway? If you know baby's sex, try out our baby name generator to get ideas for a great name. Consider how you want to break the news to your coworkers. A working mother may be considering telling her employer about her pregnancy in the first few weeks of the second trimester. Please read our advice on how to break the news to your colleagues that you are expecting. Documenting your pregnancy. We encourage you to use our free, printable belly-to-baby milestone cards as the basis for a monthly picture session documenting your pregnancy. As your pregnancy progresses, start documenting by snapping pictures of your growing belly while holding one of our printed milestone cards as early in your pregnancy as you like. For some extra giggles, try holding a piece of produce that is about the size as your newborn. You may share the finished photos with loved ones or save them as a memory to show your kid someday. Ultrasound reveals twin. Congratulations are in order if, at this time, an ultrasound reveals that you are carrying not one but 2, or more babies. What a blessing it is to have twins. Keep reading to find out how to tell if you're having fraternal or identical twins and what to expect during each week of your pregnancy. And if you're hoping for 3 times the excitement, learn all you can about carrying triplets. Consult your physician. Where can I get a flu shot, and when will they be available? When the vaccine is released, usually a month or 2 before the start of flu season, experts recommend that all pregnant women get it. From fall to spring, there is a high risk of contracting influenza. How you will break the news. Consider how you will break the news to those closest to you. You could throw a party to let people know you're expecting, or you could send a special card to your closest friends and family. No matter what you decide to do, this will be a moment that your loved ones will remember forever. Go in for routine dental care. Find out about local prenatal or birthing classes. Your doctor or midwife might have suggestions. Conclusion. By the 12th week of pregnancy, many women have experienced a reduction in, or complete elimination of, morning sickness. You may begin to feel more energized if you've been feeling particularly tired during the first trimester. It happens due to connection through umbilical cord. This week marks a major milestone for your baby, as important bodily systems and baby's vital organs begin to take shape, such as baby's intestines. At your next prenatal appointment, you will be able to listen to the baby's heartbeat if you haven't already. However, by week 12, your pregnancy bump may have started to show. FAQs. What enjoyable things can I do when I'm expecting? Pregnancy has its downsides, such as the inability to drink or move heavy objects when carrying a child. You may counteract all the no's by making a list of all the fun things you can still do while pregnant, such as your favorite type of exercise, when you feel up to it, or going out with friends for an evening of mocktails. Can you tell me how I can save the ultrasound pictures I took? Seeing your kid in utero for the first time is an unforgettable experience. Unfortunately, ultrasound images age poorly. Make sure to shoot a digital photo of yours if you value keeping it for posterity. Sometimes, ultrasound technicians may even offer to send you digital copies of the scans through email. You may also do a search on sites like Pinterest or Etsy to find one-of-a-kind photo storage and display options. If you like this video, make sure to give it a thumbs up, and also subscribe to my channel for more informative videos like this one.